Hi, I'm Darnell with Live Young Lifestyle, and I'm here today at Sunset Cosmetic Surgery with Dr. Dan Yamini and Nurse Mona, and today we are doing filler in the hands.
Yeah, this is a very common request by our patients. So there's two products on the market that are FDA approved for hand rejuvenation. Restylane has been around for many years. All your patients have heard of this.
Yes.
Radiesse as well. We've used both of these a lot on the face, but they're approved for the hands. For hands where there's a lot of volume loss and you need a lot more plumping, I prefer Restylane because it attracts a lot of volume and hydration and it plumps it up more.
Because this attracts water.
Yeah. In your case, you don't have a lot of volume loss. You just have a little more fragile skin. The texture and the collagen has dissipated.
Yeah.
So Radiesse is a good bio-stimulatory product which helps stimulate collagen growth. And it goes in very smoothly because we thin it out with saline, and it can just spread out nice and smooth. So Mona's gonna do that for you today. Okay. Same thing goes with your really good skincare.
Anything that you do to your face, you should be doing to your hands.
Okay, that stimulates collagen growth, antioxidants, and then maybe even resurfacing with lasers. So a combination of all of these treatments, including the fillers, will give you that optimal hand.
Right, you don't want to just hit a body part with only one treatment. You have to do everything. So you want to do skincare, you want to do any lasers that you do to your face. Most of the time I try to do them to my hands. When I microneedle at home, which we've done a lot of videos on microneedling, I also do those to my hands. But we wash our hands a lot and our hands are always exposed, especially you're driving a car or...
And it really tells our age.
It does. And my hands are screaming 52. So let's try to do something about it. Okay.
Let's do it.
We're going to use a cannula because this makes it a little bit easier to place. It glides right underneath the skin and we can place the product precisely where we want to put it. The first thing I'd like to have...
As opposed to just like injecting it with a needle, right? So when you inject it with a needle, which I've seen done a lot, you don't have as much control, but also isn't it a little bit more dangerous?
Not so much dangerous, but there's more of a chance of bruising. Because the needle's sharp. The cannula is a blunt instrument or device, so it kind of pushes the blood vessels.
It pushes
away.
all the
It just
blood
glides
vessels
through the tissue a lot easier.
I see. Okay, that's good.
Okay, so let's see where the volume areas are. So let's see. These are your tendons. So we want to be going between those. So she's going to be going in these
We
areas.
need to fill up the little valleys.
Enter with the cannula, so I'm just going to use the cannula and push through the tissue. And you can kind of see how it glides through.
Ooh.
And you can get right down to the area that you want to be in to deposit the product.
Now, how long does this last?
The Radiesse itself is anywhere from 6 months up to a year, just depending on the area that's injected. Typically areas with less movement may last a little bit longer, but the hands, because we are
That's
using them
probably
so much.
why they lose so much fat too, because we're constantly moving them. Is there lidocaine in this product
Yes, we mix lidocaine with it.
That's why I was thinking like this should hurt more than it does, but it feels weird, pressure and the crunchingness of it all. But it doesn't hurt as much as I'm sure it looks like it does on camera. And is there anything that I can't be doing? Can I go home and exercise?
They recommend not exercising for the first few days. If there's any
days,
I know that's
a
hard
few
for you.
Days,
at least 24 hours. Because anytime you elevate your body temperature, your heart rate, you're going to increase the swelling that you get. And this can be an area
it's for swelling.
Yes,
it's not
mainly for swelling.
It's not for the dissipation of the product.
It's mainly just swelling.
Okay. And the massaging is just to kind of
make sure
smooth
everything's
it
nice
out.
and smooth and we're exactly where we want it to be.
If you did end up with like a little bump or something, would that go away with time?
The product is moldable for a few hours, so if you see anything at all, you can just gently take your thumb and just kind of.
I see. So when I go home, if I see a bump that looks weird, I just kind of massage it a little bit. So what do you think?
I think it looks awesome. There's a huge difference. You can see the crepiness of your skin. All these little horizontal lines are gone.
Exactly.
So yeah, this is
a big difference.
Big difference.
If you can, do these kind of treatments that make it to where your hands don't tell your age,
Yeah.
That's a really good way to live young. Thank you so much.
You're welcome.